Hi everyone, this is Werner here. Yesterday I came across a very interesting article on Facebook by News 24, and it's titled "What We Do to Our Children," and it's about children exposed to trauma. So this interested me. I read this article, and let me just tell you one or two of the things that struck me about it. What this article says is that children are either beaten by their parents, sexually abused by acquaintances, or bullied on the playground. This is what almost all children in South Africa experience or are exposed to before they turn 18. So these findings have been released by the Birth to 20 Plus study. And one of the results that came out of the study is that 99% of children had witnessed violence or been a victim to it. So I think this is quite important to have a look at. So I got the article or the report, the research report on the internet, and I'm going to read you just some of the highlights. I think it's worth reading. I think you should get a hold of this and read it. I think it has very important significance, and I think as social workers and social service practitioners, we should be aware of this. So this study was published in the South African Medical Journal, March 2018, and it is available on the internet. I got a copy of it. The researchers are Richter, Matthews, Kagura, and Nontera. So I'm going to just read one or two highlights. The objective of the study is to give a perspective of exposure to and experience of violence, as well as perpetration of violence across the span of childhood. And this is a longitudinal study of children born in 1990 in the greater Johannesburg, Soweto area, who were assessed on 21 occasions, and the study follows around 2,000 children and families. So this is quite a big sample size. It's a huge study, and it's done over a number of years. So it's quite significant if you think about it. So in from the discussion, I want to read some highlights. Only 1% of the sample of children in the Soweto Johannesburg area had been spared exposure to or experienced violence in their home, school, or community. This means that 99% of those children were exposed to violence. And I think we can safely assume that the conditions in the Soweto Johannesburg area are similar to many of our townships, many of areas in cities around South Africa. I don't think it is a particularly unique environment. We have many communities where we see this kind of high rates of violence. 2/3 of the children of school-going age were reported to have been exposed to community violence, such as hearing gunshots, seeing people attacked, and so forth. Close to half of preschool children were reported to have been victims of violence. Close to half, let this sink in, of preschool children, children who have not yet entered formal schooling, close to half of them have been victims of violence. That is a lot. Violence at school was reported to be experienced by about 1/3 of primary school aged children. And around 40% of children are polyvictimized. In other words, they have been exposed to 5 or 6 different categories of violence, with having very few safe areas at home, school, community, or in the company of their peers or relationships with others. Exposure to violence, we know, have severe consequences for children. It affects the structure and the function of the brain. It affects the way that their brains and their bodies develop, and it has long-term consequences. And these consequences, the negative consequences of traumatic exposure, toxic stress, is hidden over time, because we can't always make the link between problems experienced in adulthood and children. But now through research, we are starting to see these links, and the impact is very negative. We see negative impact in terms of poor mental health, high rate of drug and alcohol abuse, a cycle of violence that repeats itself, neglectful and abusive parenting, um, even a earlier mortality rate among people that have been exposed to violence. So the cost of violence, the cost of trauma is very high. One of the conclusions from the study is that exposure to and experiences of violence are pervasive in the lives of South African children and young adults. I think we know that. We need to start to figure out ways to address this. We are becoming involved when it is too late in many instances. We know what the problem is. We have to start to design interventions that reach these children early on. If so many children are exposed to violence even before they enter primary school, it is too late to focus on when we discover them in the schooling system. We have to start earlier, way earlier. I don't have the answers, but I think we have to think about it, and I think we have to talk about it. The more we talk about it, the more we will find solutions, the more we will find ways forward. Anyway, I just wanted to make you aware of this, of the study, of this report that's available. I think it's very important for us to be up to date with this kind of thing. Please find it, read through it. It's worth your time. Thanks everyone. Have a good day.